U.S. scientists divulge 5 sleeping habits to help add years to your life. New study. Good sleep is one of the core pillars of good health, but achieving it is no easy task for some. What's more, scientific findings suggest simply getting sufficient shut-eye is not enough for optimal health. A person must also fall asleep effortlessly and stay asleep without any disruption. In total, there may be 5 sleep factors necessary for prolonging lifespan, new findings suggest. The findings recently emerged from a collaborative study by the American College of Cardiology's annual scientific session, and the World Congress of Cardiology. The scientists found that young people who adhere to a greater number of beneficial sleep habits have an incrementally lower risk of dying at a young age. The research looked at more than 170,000 people from the U.S. National Health Interview Survey. Researchers assessed 5 different factors revolving around sleep quality, using a low-risk sleep score. The 5 factors were: ideal sleep duration of 7 to 8 hours a night, difficulty falling asleep no more than 2 times a week, trouble staying asleep no more than 2 times a week, not using any sleep medication, feeling well rested after waking up at least 5 days a week. Frank Chian, MD, an internal medicine resident physician at Beth Israel Deaconess, said, "We saw a clear dose-response relationship, so the more beneficial factors someone has in terms of having a higher quality of sleep, they also have a stepwise lowering of all-cause and cardiovascular mortality." The medical expert continued, "If people have all these ideal sleep behaviors, they are more likely to live longer. So, if we can improve sleep overall, and identifying sleep disorders is especially important, we may be able to prevent some of this premature mortality." Amazon just launched its latest site-wide sale. Not all of these discounts are worthy of your time, but we've found the 23 best Amazon Spring Sale deals link with genuine record low prices. Better hurry as the sale ends soon. According to the data, those who had all 5 factors were 30% less likely to die for any reason compared to individuals who had 0 to 1 favorable sleep factor. These individuals were also 31% less likely to die from cardiovascular disease, 19% less likely to die from cancer, and 40% less likely to die of causes other than heart disease and cancer. To quantify these effects in years, the researchers noted that having all 5 factors may boost the lifespan of men by 4.7 years. Women, on the other hand, had a longer lifespan of 2.4 years compared to those who had none or only one of the 5 optimal elements. Other causes of death assessed by scientists were related to infections and neurodegenerative diseases like dementia and Parkinson's. Even from a young age, if people can develop these good sleep habits of getting enough sleep, making sure they are sleeping without too many distractions, and having good sleep hygiene overall, it can greatly benefit their overall long-term health, noted Chian. It's important for younger people to understand that a lot of health behaviors are cumulative over time. Just like we like to say, it's never too late to exercise or stop smoking, it's also never too early. We should be talking about and assessing sleep more often. More research is needed to identify how sleep boosts longevity. Past studies have shown that getting too little and too much sleep can negatively affect the heart. What's more, sleep apnea can contribute to a number of heart conditions like high blood pressure and atrial fibrillation. The researchers also called for further research to elucidate the reasons men have double the increase in life expectancy compared to women when they adhere to all 5 habits.